Tiredness and fatigue. Today's topic is about tiredness and fatigue. So, what is tiredness and fatigue? Tiredness and fatigue are common complaints that can significantly affect daily life. Understanding the causes and management of tiredness and fatigue is crucial for improving quality of life. So it is very important topic. So let's talk about tiredness and fatigue. Are they the same terminology or they are different? Tiredness and fatigue are two different terminology. For example, tiredness is the feeling of needing rest, often relieved by sleep. You feel tired, you sleep, then you feel refreshed. This is tiredness. On the other hand, fatigue, persistent tiredness, not relieved by rest, accompanied by lack of energy, motivation, and concentration. You sleep, you sleep enough, still when you wake up, you don't feel refreshed. Let's talk about tiredness and fatigue cause. So here I'm going to give you the most important thing that helps you how to approach a patient with tiredness and fatigue, which is what? Covering sleep. If your patient has hyposomnia, if your patient is sleeping less, it means most likely it is due to non-organic causes or psychological causes. Don't get me wrong, it can be also organic, but most likely it is psychological. So depression. Make sure that you cover MI-ECG pass, which is a mnemonic for depression, cover anxiety, stress, and also, as I mentioned before, serious condition can also be a cause of fatigue and hypersomnia. On the other hand, if your patient has hypersomnia, it is most likely organic. Again, don't get me wrong, it could be psychological as well, but if they have hypersomnia, most likely it is organic. So cover constitutional symptoms, cover all system, head to toe, cardiovascular, respiratory, GI system, urinary tract, hematology, endocrine, and periods of the patient, and the last menstrual period as well. So now let's talk about tiredness and fatigue causes a little bit in details. Again, the lifestyle factor comes first. Lifestyle factor is consists of poor sleep, lack of exercise, and healthy diet. Stress, obviously. Now let's move on to the second part, which is the medical conditions. So medical conditions can be anything: anemia, thyroid disease, diabetes mellitus, chronic kidney disease, even liver disease, heart disease, and I'm going to stop right here. So on and so forth. So mental health factors: depression, most important part, anxiety, most important part of it, stress again. So these are the factors or the causes. So let's talk about the initial assessment. For the initial assessment, we are focusing on two most important aspects of assessment, which is history taking and physical examination. I'm trying to be very concise here. The first and most important thing is to clarify the chief complaint. Is it weakness? Is it tiredness? Is it fatigue? Is it lack of energy? Or is just lack of sleep? Onset of tiredness and fatigue, course. Of course, we have to cover the course of tiredness and fatigue, duration of it, pattern, the timing, which time of the day it is worse, which time of the day it is better, severity, elevating and aggravating factors, for example, sleep, associated signs and symptoms, review of the system, constitutional signs and symptoms, past medical history, family history, social history. Last but not least, always rule out domestic violence or abuse. In physical examination, vital signs, BMI, sign of underlying conditions, for example, anemia, for example, pillar for anemia, for example, goiter for thyroid disease, and so on and so forth. Again, for this part, I'm just gonna stop right here, but we will cover history taking and physical examination in our NAC OSCE in details. So if you're interested, you can join us in NAC OSCE classes and you will benefit from uh, our classes for sure. It will be in person and online as well. So tiredness and fatigue, initial management. So for the initial management, I would like to divide it into three parts. The first one, what was the first cause? Lifestyle, right? So we have to do lifestyle modification. The second cause was medical condition, so medical treatment. And the third cause or risk factor was mental health. So we have to do mental health support. For lifestyle modification, improve sleep hygiene, regular physical activity, balanced diet, stress management. So basically, sleep hygiene and also exercise, balanced diet, and stress management will help the patient. For the medical treatment, it's self-explanatory. You have to find what is the underlying causes and treat it. For example, iron supplement for iron deficiency and medication for hypothyroidism if the patient has it. And mental health, counseling and psychotherapy, in some cases medication as well, but counseling will take care of it. Now, for the management, the most important thing that we have to be aware of it, and when we have to do the counseling, and we have to let our patient know that when to seek further help. In two different conditions, if the fatigue or tiredness persists despite lifestyle change, for example, you counsel your patient, you tell him all the changes, but he brings all those changes, but nothing happens. He has to come back for further help, and you have to run some more tests to help or treat the patient accordingly. Same thing with if the patient has some serious underlying condition, for example, chest pain, severe depression, and so on and so forth. Thank you very much for watching and staying with me until now. I hope you guys found this educational video beneficial. This video is prepared and posted by me, Dr. Muhammad Nasir Jawla. The main purpose of this informative and educational video is to keep Afghan female medical doctors, medical students, and healthcare workers up to date with the latest medical knowledge, especially those who are deprived from their basic right, which is to study and save life. I believe you guys are aware of what's going on in Afghanistan. This video is also aiming to raise health awareness for all Afghan in Afghanistan, and also this video will help a lot the international medical graduates who are preparing for their NAC OSCE and even MCQ E1. Thank you very much. If you guys have social media, I would love to hear from you, your feedback. Please like and subscribe our channel and support us in social media as well. Thank you very much again. And I have been using a lot of resources, but the two main resources that I'm using for my educational videos is YouWord Usmele and Toronto Notes. Toronto Notes is usually a source for Canadian IMGs, and Usmele YouWord is